CMMSPro.AI, the Sims strategist, the world's first AI-powered Sims clinical mentor. Imagine it's 10 p.m. at night. Your patient's hand isn't improving. It's been 6 weeks. You've treated hundreds of hands, but this case, you're not sure. Does this sound familiar? Well, imagine that you could reach out to a mentor and just have a conversation backwards and forwards about everything that you're considering. The truth of the matter is that Sims demands real-time integration of diagnosis, biomechanics, tissue response, and cost design all at once. Experienced Sims clinicians are scarce, and therapists often reason alone without a knowledgeable sounding board. And without consistent practice, decision-making erodes, and therapists need on-demand guidance. They don't just need a course. So, after 25 years in hand therapy, I built something that didn't exist before. So meet your new clinical partner, CMMSPro.AI. It is not a chatbot. So there are 6 stages to the clinical reasoning pipeline. The first is intake, and this is where you will enter your case details. The second phase that you will move through is analysis, and this is where you will be questioned with regards to that clinical picture before proceeding to the reasoning phase. And in this phase, this is where we are looking at pattern recognition. What is the pattern of motion that your patient presents with? You will then be following into the strategy stage, and this is where you will be planning your intervention. This is crucial because even if everything is correct up until understanding your movement pattern, there are always nuances that you might need to check. And that is where strategy comes in. And this is where the power of CMMSPro lies, because I have trained the engine to think in terms of those nuances. For example, if you've got a fixed flexion deformity of a joint, do you work on extension of that joint first or flexion? So we will reason that together through the use of CMMSPro. Then you move on to technique, and this will be cost design and cost application. So you can upload photos of your cost, and you can be critiqued on it. And we can look at what you could have done differently, just as a mentor would have. Technique is extremely important because you had to have also selected the correct cast to get the right gains. That takes us to results, where you will review the outcome measures, the documentation, and if you're an experienced therapist, you might just jump in at the results phase and say, I actually just want to show you my results. How could I have done this better? What could have improved? So what makes it powerful? Well, it's everything a Sims therapist needs in one place. First of all, everybody is getting the clinical mentor. It is mentoring style dialogue using Sims logic. It is not generic medical advice. It is like having Judy Colditz or myself in your pocket. There is 8 language support. It is therefore now globally accessible to learn this technique. I have included voice input so that you can speak your case notes instead of typing. There are diagnostic playbooks, actually 8 at the moment, and these are curated Sims playbooks which are auto-matched to your patient's diagnosis for instant clinical reference. You can upload your photos directly into the chat, and the most exciting feature for me is the downloadable session log. It can be exported with your full reasoning session, and it can be used in your patient records. And also when you come back to the AI, say 3 weeks later your patient's progressed and you don't want to give the CMMSPro the whole history again, you just upload your document and it immediately knows where you were. So the system does not save your clinical data. You have to keep uploading it every time, and that makes it HIPAA compliant. Welcome to CMMSProAI, your clinical reasoning partner and strategist. You will select your language at the top right-hand corner. The dashboard will be in English, but the communication will be in your chosen language at the moment. So unlike a traditional chatbot like ChatGPT where you're working vertically, you're actually working in a pipeline horizontally. And this helps you get a bird's eye view of your mentoring session and also helps you to clinically reason and work with a goal in mind. The sidebar is where critical information will be. At the moment, we just have some CMMS principles. You will put your name in. It's really nice to have the AI talk to you personally. And you will select whether you are new to CMMS, have some experience, or you're advanced. So once you have completed intake, you press begin analysis. And you will see that you're now on the analysis section. And there will be some prompts. So what is the end field telling you? Any signs of active inflammation, compliance potential, and any red flags. So we have a new case for CMMS reasoning. This is a patient with a metacarpal fracture. 8 months ago, he had an open reduction and internal fixation following his punch injury. He went for 6 months of physio. There was no improvement in the active range of motion. Now he has a stiff MCP joint. His active range of motion is 0 to 20, passive 0 to 30, soft end feel. Hi Robyn, I'm CMMS Pro, your CMMS clinical reasoning partner. Let's work through MS together. And the soft end feel tells us that we're working with edema and an immature scar tissue, not a rigid bony block, which is actually encouraging. One thing I want to check before we go further, is there any dorsal scarring over the 5th metacarpal joint? And if so, what does it look like? Adherent, hypertrophic, or well healed? Good photos, Robyn. This tells us a lot. In the lateral view, MS is making what looks like a reasonable fist with digits 2 to 4, but the 5th digit is clearly not participating. So it is sitting out of the cascade, extended at the MCP joint while the other fingers flex. That's a classic intrinsic minus compensation pattern of the small finger. The dorsal view confirms what you're describing. There's a well-healed but visibly tethered RF scar running longitudinally over the 5th metacarpal shaft. You can also see mild residual dorsal edema over the ulnar border. The skin is slightly fuller and the soft tissue contour over the 4th, 5th metacarpal is subtly puffed compared to the radial side. The scar is sitting flat, but the tethering to the underlying extensor mechanism is exactly what's blocking MCP joint flexion. The EDC and peritendinous tissues are anchored to the plate or callus below. So we have a stiff 5th MCP joint, a tethered dorsal scar adherent to the extensor mechanism, residual edema, and 8 months of cortical entrenchment of compensatory pattern. This is a textbook CMMS presentation, Robyn. Before we go to reasoning, has MS had any psychological or compliance concerns flagged, or is he motivated and ready to commit casting? So that's just a lovely summary and some food for thought. And what you can see is that on the left-hand side, some playbooks have popped up. So these are clinical cases where the therapist can go and learn from. So there's a non-united metacarpal fracture or this metacarpal fracture post-RF. So this is a similar case. If they click on that, they will get some clinical information about protocols that were used and clinical tips and red flags and a treatment roadmap. So that will be available in the CMMS Pro portal as well. And then there's some clinical guidance that pops up here on the left. He has no psychological or compliance concerns. He is very motivated. Perfect. A motivated chartered accountant who wants his hand back. That's a great starting point. Robyn, what pattern of motion do you see here? And which CMMS cast were you thinking of? So as this patient has dorsal structures that are restricted and he has full PIP and DIP joint motion and no MCP joint flexion, he has a dominant intrinsic minus pattern of motion. So therefore I'm thinking of an intrinsic plus cast. Exactly right. The tethered dorsal scar is anchoring the extensor mechanism, the IP joints are moving freely, and the 5th MCP joint can't flex. That's a textbook intrinsic minus pattern, and the intrinsic plus cast is the correct answer. So now the cast reference picture comes up. So here we have an intrinsic plus cast. The wrist is always included, the MCP joints in flexion, and the IP joints are free for active mobilization. So there's a nice visual for the therapist. So now it's asking, are you ready to move to strategy? Tell me, what are you thinking for the cast design, the direction of focus, the wrist position, and how long you plan to keep him in the first cast? Certainly an intrinsic plus cast, just like the image you've referenced. I want to have the wrist at 20 degrees of extension, and I want to put the MCP joints in as much flexion as possible so that he can move away from the hood of the cast. I think he'll need it for 3 weeks. Spot on. The wrist is at 20 degrees of extension, the MCP joints are in maximum flexion, the hood is doing the work. 3 weeks for cast 1 is exactly right. One detail to lock in before we move to technique, given that only the 5th MCP joint is affected, are you planning a full 4-finger intrinsic plus cast, or are you considering a hand-based design for this one? Definitely a circumferential cast. I need to block the wrist in extension, and all the fingers need to work together. And that's the right call. The extrinsic tendons share a common muscle belly, so all 4 fingers working together against the hood is far more powerful than isolating the 5th. The circumferential design also gives you that continuous dorsal pressure acting as a pseudo massage on the tethered scar, and it's exactly what this hand needs. Let's move to technique. You're making a forearm-based intrinsic plus cast. Walk me through your construction. What are you going to do first? So I'm going to make sure that I clear the distal palmar crease. I'm going to have the wrist in extension about 20 degrees with the MCP joints in maximum flexion. I want a good aesthetically pleasing cast. I want it comfortable with a double layer of stocking net so it's not too tight. Is this correct? That's all correct, Robyn. A few things to add that will make this cast work hard. The dorsal hood needs a minimum of 20 layers of POP. This is what holds those MCP joints in maximum flexion against the pull of the extensors. Don't skimp here. Give MS a piece of memory foam to wedge between the proximal phalanges and the dorsal hood from day 1, as soon as he gains range, and with a motivated patient that can happen within hours. He pushes the foam in deeper to ratchet the MCP joints further into flexion. And his exercises constant cyclical repetitive motion away from the hood while keeping his PIP and DIP joints moving freely throughout the day. The Netflix analogy works well here. Move during the ads, rest during the show. And one quick thought, have you got a clear view of the dorsal scar character on MS? Knowing whether it's still pliable or more mature will help set realistic expectations for how quickly the cast pressure starts shifting it. The dorsal scar should respond really well to the cast. So I think that it will help to lengthen the scar and allow MCP joint flexion. Agreed. The continuous circumferential pressure combined with this active motion away from the hood will act as a pseudo massage on that dorsal scar, lifting it off the underlying fascia and restoring differential glide. Soft end feel at 8 months is actually encouraging here. It tells you the tissue is still responsive. MS sounds like a good candidate for quick early gains. As a CA, he's likely motivated and compliant, and that should not be an issue. Shall we wrap up to results and pull together the session summary for your records? Yes, please. Okay, so the AI has now provided me with a lovely session summary for my notes. There's a download log button, and this means that when you come back, you can upload your session when you want to put your results into the AI and carry on with the mentoring or analyze the results that you've got or look to see where the problems are. But it tells you we do not store patient data on our servers. Your local download is the record, and this keeps this tool HIPAA aligned. Good luck with this, Robyn. This one should respond beautifully. You're welcome, Robyn. Get that 5th MCP joint moving. MS is in good hands. Whenever you're ready for the next case, I'm here. So this is CMMS Pro. As you can see, it's incredibly sophisticated. This is a safe tool for learning, a safe space for mentoring, and you can ask it any question you like and it's going to respond. Now, 80% of therapists reported a significant reduction in clinical anxiety when treating complex cases using CMMS guided logic. This is over my years of mentoring. So that's not a small thing. Confidence changes outcomes. There is a 70% reduction in case planning time from 45 minutes of second guessing to 4 minutes of structured AI guided logic is so worthwhile. And it doesn't replace your thinking, it organizes it. But then to also know that you're going to achieve these outcomes 70% faster than using traditional methods, well, that's a good number to remember. Let's address the elephant in the room. The myth is that AI will replace your clinical judgment versus the reality that AI amplifies 25 years of expertise. So really what you've got is everything that I have learned over the decades available to you 24/7. This will be for every therapist in every time zone, in every language. It doesn't decide for you, it actually thinks with you. Let's look at your CMMSPro.AI journey and where you decide you will choose to be. Remembering it's more than a chatbot, it's a complete clinical ecosystem built for CMMS therapists worldwide. Everybody gets fast-track training. When you sign up as co-pilot for as little as $9.99 a month, you are going to have more than 5 hours of clinical training within the portal. So you will have access to the CMMS masterclasses, the movement patterns, the cost demonstrations, the tools and materials that you will need. You will also have access to CMMS Pro, which is the clinical mentor, the 6-stage pipeline I've showed you, the playbooks, the voice, and the photo. You will also have as co-pilot the upper limb functional index assessment. You'll have access to how to bill and code. And I'm giving you access to some panel discussions, which just help you understand where other therapists have come from. And I've also included therapist surgeon panels where you can draw on how to approach your surgeon, what surgeons think about it. You can even quote Dr. Lalonde or Dr. Patel or Dr. Roulette and just refer to those great minds in terms of gaining confidence in applying this technique to your patients. Then we can move on to the Catalyst option, which is $39.99 a month. And this is where you can go further. You can actually watch surgeons' lectures. You can then develop a strong sense of community and belonging. And you can join our monthly in-person membership club where you can bring your case and we can go through and analyze. Moving into the Legacy Circle option, it is $290 a year. So it's a huge saving, but only for 25 therapists. Let's just compare if you use generic AI versus CMMS Pro. The CMMS Technique knowledge is built into CMMS Pro. The clinical reasoning framework is built in using a 6-stage pipeline. There is cast design guidance with a deep dive into 5 stages one can consider. There are auto-matched diagnostic playbooks, and this is also drawing on real cases. And are also cross-reference. So all the CMMS clubs that for this year are actually in the portal, and we cross-referencing. So you can look at the playbook and then go listen to the 1-hour mentoring session to get a better understanding. And of course, Judy Calder's CMMS logic is embedded where none of this is available in generic AI. Got 3 options. You can join Copilot for $9.99, and this is for the curious. You can also join as a once-off $99 a year. You get your unlimited AI coach, voice and photo upload, 8 languages, masterclass and playbooks, community access actually comes into Catalyst. In Catalyst for $39.99, you are getting the full CMMS online course. I mean, that in itself is exceptional. You have everything in Copilot plus these 45 lessons. You're going to have access to the CMMS Club recordings. You're going to have an accreditation pathway, plus the monthly webinar and priority support and the community. If you join Legacy, this is the founding circle. So you will have Copilot and Catalyst for 12 months. So you have access to the full CMMS course. You will have a founding members badge, lifetime recognition, 6 months of direct access to me to help you, and the input on future development. So this isn't going to reopen. So the decision is really not about whether or not Sims works. You know it does. But now you actually have 24/7 access to it. You can start tonight, cancel anytime with no contracts and no lock-in.